So the next transfer, if we do not have strength in upper extremities greater than or equal to a 3 out of 5, we have to go to the last transfer on the right, your one person dependent lift transfer, okay? This is where it is going to be seated transfer, no board or anything. It's one movement, but instead of the patient pushing and unweighting and moving, their arms are in their lap, it is dependent. You are moving them by yourself, okay?
Which one are you doing again?
All the way to the right.
Not a mechanical lift, the actual
Correct.
lift.
Correct, yep, no mechanical lifts.
Are we gonna use a Hoyer lift?
Not in this class.
I'm not sure I see it when it comes.
So all the way to the
One
right,
person dependent lift
under seated
transfer.
transfers, one person dependent lift, okay? So it's gonna be the same kind of movement as the lateral swing, same blocking, but your patient arms are gonna be in their lap so that they stay out of the way, otherwise they may get caught against the wheelchair. So have them crossed in their lap, and then you're gonna do head hips and rock, and then you're going to pivot them over to the wheelchair, okay?
Like sternal percussion.
There are 4 variations of this. You get to pick one, whichever one you want. But I will show you 4 variations that you can use based on your preference, the size of your patient, the length of your arms, things like that. Because based on how tall you are, how large your patient is, or how short they are, there's different techniques that can be beneficial, okay? So if I can get a patient, all right.
Yeah, I'm a bariatric patient.
Adrian, scoot back over.
All right,
Good.
so we'll come forward.
good.
Once again, we are at a
You good?
45, actually, I'm sorry. Yeah, you're good. There, that's good.
Lucky.
All right, wheelchair is at a 45. Once again, that armrest is out of the way for obvious reasons because we're not coming to a stand, we are just pivoting over. This patient, they are not really able to assist you in coming forward, so you're really going to have to use that head-hips relationship and pull one hip, head-hips relationship, pull the other hip forward to slide them in the chair. Again, the last hip you move should be the one closest to the bed to start that rotation. And then we're gonna use the head hips. They're gonna look down and away, and you are going to transfer them over. You're gonna rock, and the last one, you will lift them up and put them down, okay? You have to clear the distance between the wheelchair and the bed, the brake, the frame of the wheelchair, so you do have to come up slightly. You do not need to pick them way up in the air and plop them down. You just need to clear a couple inches, okay? So I said there's 4 different techniques. What that changes is where the patient's trunk is, whether it's against my shoulder or against my hip, and whether I'm holding gait belt or if I'm holding underneath the pelvis, the ITs, okay? So those are the 4 variations that we'll go over. So caster wheels, same position as before, facing out. Bed height should be equal or so to the wheelchair. It's based on the patient's height. For me to move her forward, armrest should be in place. It's the last thing to come off before you do the transfer. So I'm gonna move this side first. I'm gonna do head hips. She can lean away, and she can have her arms in her lap because now we are dependent. So she's leaning down and away, and I'm 1, 2, 3, and then my arm goes through here. Actually, because her arms are in her lap, we can kind of go around this way. She's gonna look away. 1, 2, 3, and we're pivoting. When they pivot forward, make sure you're ready with your block because they will just fall forward. This patient is dependent, okay? Maintaining trunk contact. You're gonna get the armrest out of the way. Okay, so the first one I'll show you is, if you guys wanna write it down, sternum to shoulder with a gait belt hold. So these are all one person dependent lifts. These are just the variations here. Which technique you choose doesn't matter to me, okay? But this is sternum to shoulder with a gait belt hold, which means my patient's sternum should be on my shoulder and I'm holding the gait belt. Her arms are gonna be in her lap, so I'm going around the patient, not through like her armpits, okay? I'm gonna squat down at my AP stance. She's on my shoulder. 1, 2, 3, shoulder, and I can come up. Okay? So that was her sternum on my shoulder, gait belt hold. To go back, get reposition. Okay? Next one will be sternum to shoulder with an IT hold underneath the pelvis. Is that okay with you? Okay. So I'm gonna angle her heels the direction we're going. Armrest is already removed because we're going back to the wheelchair. Head hip, she's gonna lean down and away. I still have my AP stance. The leg closest to where we're going is back. We're down here. You're underneath the ITs. Number 1, 2, 3. And then up to the trunk to make sure she's back in the chair. You put the armrest down. Okay? Questions on those two so far? That's a lot of talking. Okay.
Run that by me again, please.
Not exertion based. I'm sorry.
Can you do it over?
So I'm gonna do 2 more.
Okay.
So
go
you'll
ahead.
see all 4 variations, okay? Both of those were her sternum on my shoulder.
Probably
The
get you
pain or the
one.
therapist that benefits is if the patient is tall. If your
Wow.
therapist is short and the patient has a tall torso, it just naturally is easier if they're kind of up over your shoulder, right? So if you have him as a patient, his torso is tall and you're shorter than him, it just makes sense. If you squat down to have him up on your shoulder, what that does is helps you unweight him easier than just like using your arms and grunting through it, okay? The next one is sternum to hip. So now instead of me being underneath the patient, I'm gonna be up over top. They're gonna come down towards my hip. They're gonna be leaning very far forward. Why might some patients not like this?
Getting close to the
Feeling
floor.
like they're
Looking
falling.
right where they could potentially go, and they can't stop themselves. So a lot of patients don't like this. So that spinal cord injury patient that I mentioned earlier, this is the technique I wanted to use. He was not a fan, so I did not get to do that. But because he's so much taller and larger than me, that would have been advantageous to me. And I didn't get to do it. But it's good to know, because if your patient is obtunded or is okay with it, they trust you, you've built up that rapport, that can be appropriate, especially when they're larger than you, or if your arms are short, okay? So what that looks like, again, we'll just have her slide forward. We've seen it a dozen times now. Okay, I turn her heels, set my block. Now her sternum is gonna go towards my hip, away. I'm gonna be, so this is sternum to hip with a gait belt hold. 1, 2, 3, and then we set them up. Does that feel easy?
Yep.
Okay,
I feel
super
like you
easy.
had a lot of control over my
And I'm not really having to lift because it's just, her weight is so far forward that I'm barely putting any force into unweighting her pelvis, and she just swings over. So we'll go back. Now it's going to be sternum to hip with an IT hold. Obviously you have to have a little bit longer arms to reach all the way down, so the gait belt can be nice if your arms are shorter. Okay? So once again, heels facing this way, my block, we're gonna go down and away. 1, 2, 3, and then sit them back up, and then you put the armrest on. Okay? Does everybody have those 4 variations written down? They are all called one person dependent lift. These are just 4 variations. Whichever you choose, that's fine. You don't need to tell your grader which one, unless you want to, just to verbalize it. So all of those are appropriate. Whichever one you like the best, just stick with that one.
What's the last one called? My bad.
Last one is sternum to hip with a IT hold, ischial tuberosity. It's either a gait belt hold, which is underhand grip on the back side of the patient, or it's ischial tuberosity underneath the pelvis. So go ahead and practice. If you don't want to practice all 4,